I'm Peggy Peck, MedPage Today, at the American Society of Clinical Oncology meeting in Chicago. Head and neck cancer surgery carries a high morbidity, dry mouth, difficulty with the pain in the shoulder and in the neck. Researchers from Memorial Sloan-Kettering suggest that acupuncture may be one way to reduce this morbidity.
Neck dissection is a common procedure for treatment of head and neck cancer. There are different types of the procedure that vary based on the structures that are resected and, as one would anticipate, the side effects associated with the procedure, which vary with that extensiveness. Pain and shoulder dysfunction are common following the comprehensive neck dissection, particularly when the procedure is unmodified. And what I mean by unmodified is that the surgeon attempts to preserve a critical structure for function, such as preserving a nerve which allows one to move your arm over, above your shoulder. Not surprising, then, quality of life and employability may be adversely affected by this pain and shoulder dysfunction. Although physical therapy, exercises, and/or anti-inflammatory drugs are widely prescribed to address the pain and dysfunction following neck dissection, their efficacy is often disappointing or incomplete. In addition, postoperative radiation is frequently administered as an adjuvant after neck dissection because of the extensiveness of the tumor that prompted the neck dissection in the first place, leading to xerostomia or dry mouth, which further adds to the symptom burden of the patient. And so my co-investigators and I did a randomized trial in patients with pain and dysfunction after neck dissection for head and neck cancer. And the randomization was to 4 treatments of acupuncture versus usual care, and by usual care we meant things like physical therapy or anti-inflammatory drugs taken per patient preference or physician recommendation. Patients were selected in that they needed to have undergone a neck dissection for cancer. They had moderate to severe pain or neck dysfunction afterwards attributed to the neck dissection, and that they were 3 months out from surgery or radiation so that you wouldn't have the confounding of the acute effects of those procedures. There were 58 evaluable subjects, 28 randomized to the acupuncture arm, 30 to the usual care arm. There were 2 primary objectives. The primary objective, there were 2 objectives. The primary objective was to determine whether acupuncture reduces pain and dysfunction in cancer patients with a history of neck dissection. This was measured using the constant Morley score, a composite score of pain, function, and activities of daily living. The constant Morley score is a well-recognized instrument, often used as a gold standard for the assessment of other measures of shoulder function. And this assessment was structured in a way such that the assessor of the outcome was blinded to the allocation. The results for this primary endpoint show a significant improvement in acupuncture at the p equals 0.008 level. To put that in perspective, if one considers a 33% or greater improvement as being a significant response to acupuncture, 39% of patients in the acupuncture arm met this metric as opposed to 7% in the usual care arm. The secondary objective was to determine whether acupuncture relieves dry mouth in this population. This was measured by xerostomia inventory, which is a validated measure. And the results of this assessment showed a significant decrease in xerostomia in the acupuncture at the p equals 0.02 level. And again, to put that p-value in perspective, again using this 33% improvement metric, 5 patients had improvement with acupuncture at that level as opposed to none in the control arm or in the usual care arm. The next slide shows pain scores over time. Again, the upper gray line would be the usual care group. The black line is the acupuncture group over the time of the study, showing improvement in the pain scores over time, which was significant. In conclusion, then, significant reductions in pain, dysfunction, and xerostomia were observed in patients receiving acupuncture versus usual care. Acupuncture was well tolerated. Although further study is needed, particularly for the secondary endpoint, these data support the potential role of acupuncture in addressing post-neck dissection pain and dysfunction, as well as xerostomia. Acupuncture appears promising for patients with these post-treatment sequelae. Better defining which patients are more likely to respond to acupuncture for these symptoms and the optimal timing and frequency of therapy are topics of interest for future research.
So to sum up, acupuncture reduced dry mouth and reduced stiffness and soreness in the shoulder. At ASCO, I'm Peggy Peck, MedPage Today.